In a teenager, is depression more easily identifiable in how I feel or how I'm acting?
So I think that it's both, but the sign for a parent is the behavior. So if all of a sudden your teenager is not doing the usual activities, is no longer interested in football, is no longer texting constantly with their friends, is no longer interested in the food that they liked before, or their sleep pattern has changed dramatically, or their attitude towards school has changed, those are all red flags. And I'm not talking about a day, I'm talking about 2 weeks where a parent says, there is something different. Now, certainly if a child tells you, a teenager says, I feel miserable, I feel like I wish I was dead, that is something a parent has to act on. I think that what all young adults and teenagers struggle with is impulse control and the intensity of their feelings, and simultaneously loneliness because of that self-consciousness. And so those kinds of impulsivity also affects the way they think. So they freeze, or they're boiling, or they hate you, or they love you. There's no like, there's no, that warm disappears. It's always boiling or freezing.
0 to 60 quickly.
Right, and in many ways, they're like a Ferrari with bicycle brakes. And so what you have to do with a teenager is wait them out. You don't minimize them. You don't say, oh, you're not freezing, or it wasn't the worst day of your life today at school. I mean, that's silly. You have to say, things like, how can I make it better? Or what was something that made you feel better at school today? Or can you tell me the worst thing? Maybe we can figure out a way to problem solve. Once you make the diagnosis of depression, the treatment choices we have are pretty impressive. So if you treat someone with cognitive behavioral therapy, that's a kind of treatment that's 10 or 12 sessions. A psychologist who's been trained in CBT knows how to use it. And basically the way we feel is affected by the way we think, which affects the way we behave. And if you could break that cycle, that's what CBT is about, and teaching someone that sometimes you have cognitive distortions, that you think you're ugly or you think you're unlikable, and that's your depression tricking your brain. If you do CBT for 4 weeks and the patient, the teenager, is not any better, then the suggestion would be continue the CBT, which is giving you tools, and add medication. And the medication you would add is something called an SSRI, a Prozac, Zoloft, one of those medicines that makes serotonin more available in your brain. Here's the best news: 71% of teenagers who have depression, who get 12 weeks of CBT along with medication, get better.